In campaign 2020, she had the plan, and now she's telling us how she will pay for it. Democratic presidential candidate Elizabeth Warren's Medicare for All comes with a price tag of more than $20 trillion, and it is being met with some harsh criticism. CBS 2's Jessica Moore reports.
Senator Elizabeth Warren back on the campaign trail just hours after outlining how her Medicare for All plan will be funded.
So we can have Medicare for all without raising taxes 1 cent on middle-class families.
Medicare for All would do away with all private health coverage and put every American on government-run health insurance. Senator Bernie Sanders wrote the bill, but he has said it would likely lead to tax increases for the middle class. But while Sanders still hasn't outlined how he would pay for the plan, now Warren has, saying it's important to fight misinformation. Warren plans to fund the $20.5 trillion endeavor by employers paying trillions of dollars to the federal government in lieu of the money they currently spend providing health coverage to employees. Employees would be taxed on additional take-home pay no longer spent on health insurance. The plan also cracks down on tax evasion and fraud and targets the financial sector and large corporations and private investors alike with taxes on financial transactions such as stock trades. Finally, Warren's plan beefs up the wealth tax, with billionaires paying 6% on wealth over $1 billion. At an August union convention in Las Vegas, Senator Warren promised to bring members to the table when negotiating health care. But at least one union boss here in the city tells me he isn't buying it.
Sometimes when you're brought to the table, you're asked to get on the table because you're the meal.
Gregory Floyd is president of Teamsters 237, representing 24,000 city workers, from NYCHA employees to school safety agents, most of whom he says would never vote for a candidate running on Medicare for All.
This plan is a disaster. One size does not fit all. You have to find a way to work with the private health insurance companies as well as those who don't have health coverage.
Floyd says he worries about the thousands of private health insurance jobs that will be lost under the plan and is convinced his members would lose bargaining power at the negotiating table.
We take a lower salary to make sure that we have health coverage for our members.
Warren says she will release another plan in the coming weeks on how to transition to Medicare for All. Sanders says it will take 4 years. In Midtown Manhattan, Jessica Moore, CBS 2 News.
And Warren says that her cost projections were authenticated by President Obama's head of Medicare. For more information on the candidates' health care plans, we have put a link on our website, cbsnewyork.com.